uniform consists of a blazer, okay? Consists of pockets for what a technician would use on a regular basis, carrying their H.E.R cell phone, carrying a notepad, carrying their keys. Doctors often use a lab coat for this sort of nature, so the blazer is kind of a spin-off of the lab coat the doctor wears for H.E.R verified technicians. Some sticky notes, any utensils such as a makeup brush, chapstick, or lipstick, in my case. And then along with that notepad, a pen. So it also consists of a badge which holds the BLS certificate, basically like a ID card, identification card, that says that they're BLS certified for my H.E.R verified technician, just in case the patient passes out in the elevator or in a cafeteria or in a stairwell where they are present, and they can begin the CPR process while they call for help on their vocera or through their cell phone if they're in the hospital or in that situation. And the code blue, they can start code blue themselves. BLS stands for Basic Life Support, so CPR. HIPAA certified. Basically, this being visible helps the patient to identify who they are. At the bottom, you'll see it says H.E.R verified technician, has a picture, has their name. And this is my driver's license. It's just a replica of what a potential ID badge could look like. Also, they won't need to carry their wallet. They can lock all that up in a locker when they go to lunch. Or to the cafeteria, they'll have a corporate meal card, which the company will use their earnings and gratuity to sponsor their lunch, so they'll never have to worry about budgeting for lunch. They'll always be able to get their snacks on their break through the cafeteria, and they'll automatically either be deducted from their check, or the company will offer bonuses and incentives and fill their lunch cart. It'll be a prepaid card, no credit check, so despite the status of the technician, they'll all be approved for the corporate meal card. So prepaid cards don't require a check. Also with the corporate meal card, we'll partnership with surrounding restaurants, such as maybe Chick-fil-A, Papacitos, Pia Chains, and things like that. So they'll be able to also use it outside of the hospital as well. That's the whole intent behind it being a prepaid meal card issued by the corporate from the Healthcare Intelligence Agency, which the employee will be an H.E.R verified technician under. It'll have their name. It'll be just like a regular prepaid card. There'll be a limit set, and there'll be a daily limit. So therefore, they'll always have enough to make through the whole 30 days. So for example, the daily limit would be $20, which is an average CPA, per person average at a restaurant. So they can spend $20 a day, and it'll only allow them to spend that for the whole 30 days, and it'll reload every 30 days. Similar to a food stamp card, Lone Star card, which allows you to spend however much you want to spend. You just get it all lump sum in the first of the month. But I think it'd be great if my corporate meal card gave them a daily spending limit, so that way it can ensure they have a meal all 30 days. Yeah, sometimes we get a little excited and over budget, so it would be a great way to teach all of my technicians who will be college graduates, people with associate's degrees, technical training. They'll all be certified through H.E.R verified technician training. So, but budgeting is one of the things that you didn't expect your employer to teach you, but this meal card will do that. So those will be in the badge. The last thing that will be located in the badge will be an identification card. And as you see, if little stuff gets on this badge, it's replaceable, and you can wipe it off with disabilities or any accommodations they need, this card will be someone that can be called just in case they need their medication brought to them at the hospital. They can't leave. They're in a crisis. They have to stay overnight at the hospital because we go in overflow and there's an emergency preparedness. It'll be basically someone that they can get in touch with, and we can get in touch with in any situation. If they passed out, if they end up being a member of the hospital or the healthcare facility, we always want to know who to contact and where to go to get help for my employees. A lot of employees don't do that, they just take it at the beginning, but this will be carried with them, so no matter what happens to them, they'll always, when they're on our premises, they know that they're safe and that we can get in contact with a loved one. And, sometimes your contact changes over a time frame. I expect my employees to be long-term investments and long-term commitments, so it's going to change. So they'll always have the updated information. The other thing is, especially altered mental status. You never know what can happen to you. They could have a seizure or anything. I definitely want to get them the support and help they need immediately, so they can even put their doctor or things like that on here as well. On the back side will be most important numbers. The first blank they can fill in with whatever numbers they want to put in, how they want to identify those individuals. And then at the bottom will be for the county that they're located in, just how Medicare and Medicaid goes by the county. You can look up the county, and it'll have all the suicide crisis lines, the Metro Care services, psychiatric services, the police department, emergency and non-emergency. For example, Collin County has North Star value options, ADAPT, and the Dallas Police emergency, non-emergency, and some other liaisons and things of that nature. And this will be laminated, and they'll keep this with them. This will enable them to give patients the numbers they need for the county that they're in case they're staying with a friend, in case they're out of town, if they got a hotel, whoever they need to get to, my technicians will have those numbers. The goal of the H.E.R Verify uniform is to be prepared for anything. Anything the patient could possibly request, or anything that could happen to one of my employees. I want them to be prepared, know who to call. It's not always knowing every single thing in life or knowing how to do every single thing. It's knowing where to get the information. If you can know where to get the information, who to call, or who has the information, that's the most important thing. And that's what this badge with these 3 items will provide. Where to get the information, funding, and identification purposes, because they deserve to have their credentials displayed. Also, I think when patients see that they're HIPAA certified and they don't have to fear that their information will be disclosed, it'll be great. And then we'll hand out like friendly brochures to ensure that everyone is aware of what HIPAA is, so they don't have to feel like they have to withhold information from us when they come visit. Also on the back, there's going to be the fire department, the police department, EMS. Sometimes situations arise in the hospital, and we want to establish relationships with law enforcement, the fire department, and EMS for any type of behavior that's not suitable, especially in cases of code pinks, in the case of a disaster, in the case of violent outbreaks in the hospital, in case there's a death and someone doesn't handle it well, someone brings a gun into the hospital. We want to have a very strong relationship and fast response team. I want all my team members to know who to call, and if they witness something that they would like to report to EMS, the police, or the fire station, who knows what authorities to go to. Someone breaking the law, maybe unplugging life-saving equipment to plug up a vacuum cleaner on accident. Whatever they witness, whatever they want to report, they have those numbers to do so. We'll have a relationship with them, and things will be confidential if they choose to have their information not disclosed. But I definitely want my technicians to be in the habit of reporting inconsistencies, because if we start letting things slide by or go underreported, then that leaves the opportunity for malicious behavior to occur from people who take advantage of the fact that, oh, they're not going to do anything, or they're not going to report, or they don't even know what to do in that situation. That's not going to be the case. We're going to know how to handle every single situation. And if we don't know how to handle it, we're going to have the number to the person of contact and get it solved that way. It all starts with just knowing the protocol and procedure. Okay? The other part, back to the physical attire, they'll have Bluetooth headphones. Okay? So in the hospital, they typically use H.E.R right now to communicate. That's usually for the healthcare providers. My technicians will have a personal cell phone that's separate from their actual cell phone that they use to make phone calls. And this cell phone will be for patients to call my verified technicians on. They can turn it off. They also will have access to electronic tablets, okay, which will be similar to the size of the iPhone, maybe a tad bit bigger, depending on which type of computer device, portable computer device we decide to choose to implement the H.E.R verified software and DPE tracker on. So basically, if this is a patient giving a phone call to me with H.E.R, if they're on the line, it's busy, patients don't have access to H.E.R. So I'm a patient, I'm going to save the number when I meet my H.E.R verified technician as I get admitted, to let them know that they're going to be taking over the room and keeping it clean for me and doing any other products and services that H.E.R verified technicians offer, which I will go into later. They're going to be labeled as the H.I.A. Healthcare Intelligence Agency Outreach. Okay, so that's what we'll like them to say, and as you can see, they'll have good service. Like I said, the minutes and everything will be paid for by the company. It'll be so they won't have any issues. They won't be responsible. As you see, it rings. So, you know, this phone here, Samsung, and depending on the provider we choose to partnership with, I don't think that service will be an issue. Patients will be able to contact their technician and request services at the drop of a dime. It'll be a priority based, so if there's emesis, vomit all over the room, or gunshot wounds, multiple gunshot wounds bleeding all over the room, and they call and request for cleaning, then of course that's priority. If it's a family supportive event, services being provided, where they're requesting DVDs for movies, for entertainment for the kids, the mom's on dialysis, she's been in the hospital for a week now, has jaundice. It's kind of traumatizing for the kid, but the kid wants to be with the mother. So we're going to have a DVD unit where we're able to connect to the television and have them be able to rent and watch movies. They can even buy the movies if they want to. If the kid just absolutely loves it, we're not going to, you know, keep them from getting the movies. We'll get more movies. There's plenty of ways to get, you know, entertainment for kids. Preferably maybe like a family pack where it has like 20 movies all in one. The kid can just sit there the whole time and watch movies. We don't want to necessarily do book reading or tablets or games because they transmit bacteria. We have to that'd be an additional thing. We have to sterilize toys and stuff. So we just want to keep it to where the TV's on the wall, the child is entertained through television. It could be learning environmental shows or community shows, anything that would keep the child interested and off the stress of the mother that she sees yellow in the eye, yellow in the body, with jaundice, on dialysis, you know, hanging on for dear life. So we want to minimize the trauma for the child. So of course, that child's need to, you know, see a DVD, that's important to us. We care about that. We want the child to be entertained and be in the best mood possible. The family, the brother, the sister, the mother, the cousins, the aunts, whoever's coming to visit, we want them to have their entertainment, and there's going to be lots of luxuries that they can purchase for overnight stays that are unexpected, especially with labor and delivery. The children is just a basic general example. So that would be like a second priority. So the first priority would be the gunshot wound or the emesis vomiting all over the floor and things like that. We want to clean that first before we deliver items to the rooms that technicians will be assigned to. We won't discriminate against isolation rooms or anything of that nature. The way we will handle universal precautions, even though a technician is assigned to a particular room they're only going to be allowed exposure to that room twice within a shift period, which can be from 4 hours to 12 hours. And just minimum 2 exposures. So, 2 requests. They can go to clean and they can go to deliver goods. If that patient has more than 2 requests, more than 2 phone calls to that technician, they'll be switched over. They'll be prompted to contact the next technician upon that visit, and there'll be a new technician assigned, and then they'll be able to have a maximum of 2 visits to that room. We don't want to, overdo dressing down for PPE over and over and over and over and over, going to the same room, or allow patients to abuse our guests. Maybe one technician may be a little more lenient, personality-wise, or maybe more extroverted, or maybe introverted. We want to keep the diverse fairness amongst everybody, so no one is discriminated against. So with those isolation rooms, minimum exposure to pathogens and communicable disease transmission causes. We don't want any mishaps, and we have our technicians just kind of trade off on that. The rooms that are not on isolation precautions, where there's not like an airborne illness, because think about it like this. If I was to assign a technician to airborne rooms all the time, this technician, well, I always have to go to this airborne, okay? Why do I always have to do the airborne? Why do I have to keep going? I have this patient, they keep bugging me all day, calling me. Well, it's not fair to them. That's continuous exposure. Continuously having to dress down for PPE. Continuously having to, be potentially exposed to the harms that are associated with that room. We don't want anyone to feel like they're being singled out. So that's why they'll have a 2-visit maximum, and then they'll switch to another technician. There you go. It's fair for everybody. And it'll just rotate around the circle. If we have to pull names, it can go in alphabetical order. It can go in random order. Whichever way my teams at the hospitals feel like they want to trade off on going to universal precaution rooms. Especially with certain units. So if a certain patient is assigned to the burn unit, like for example at TMC Medical Center, they have a burn unit, a lot of those rooms are on isolation. So therefore, that 4th floor or 5th floor, whatever floor it is, if that technician is trying to be in that room, we're always going to have to use PPE to go into the room and do inventory and clean and things like that. They're always going to have to be exposed to, have the potential to be exposed to communicable diseases. So we don't want that type of discrimination or that kind of singling out in our company. So everything will be a trade-off. Everything will be in rotation status, no matter what shift and no matter what hours you work. So patients will be able to call our technicians directly and make requests. Our patients will be informed that they can receive confirmation or their place in line via text message. They can receive their place in line in communication from direct answering. The reason why we're going to use text messaging if the technician uses them. They could be in decontamination, wearing their headphones, outside of decontam. When they're in decontam, the headphones, they're not part of the PPE. There's no way to protect their headphones. So, we're going to do the standard gown, shoe covers, gloves, hat, goggles, and things of that nature. We're going to not have the Bluetooth headphones and cell phone. Well, the cell phone's okay, but not the Bluetooth headphones, because this goes inside of the ear. So the ear canal is very delicate. We don't want any splashing of, liquids or anything to get in the headphones or anything. The phone's fine. It can go in like their back pocket, but they'll have a gown over it. But the headphones, since they hang around the neck, they'll be in PPE, so this will not be a part of the decontamination uniform. So therefore, they'll just respond through text messaging. If they're in the hallway or if they're in the collection room where we're all collecting and team meetings or whatever it is, they'll be able to respond to their patients. Have their Bluetooth hands-free. All they got to do is press answer, talk to their patients, see what they need, let them know what's available. They can email them brochures. They'll be able to, have brochures delivered about services. Kind of like when you go to a hotel, they have a menu there on the bed for you, all the things that are available for you, dry cleaning, whatever. We're not going to that extent, but that's the example that I would like to use. So, okay. So, and this iPhone has a flashlight, so that's definitely a good feature. But however, my technicians, since we're all in uniform, we'll have flashlights, because that's going to be part of the cleaning in deep crevices, making sure we get hair and things that nature out of the equipment. So even though the iPhone has a flashlight on it, we're going to have these flashlights that they use when they're in decontamination. And I will do a presentation on sterilizing IV pumps and also some of the EPA, FDA, CDC government guidelines that are being provided, and incorporating those into the rollout of the H.E.R verified technician and the DPD tracker corporation, the Healthcare Intelligence Agency. So I'll be incorporating more about that. That's another part of the tools. So this won't actually be carried with them at all times unless they choose to, but it is part of the tools. And it can be wiped down and sterilized as well as the metal. The next part of the uniform, as you can see, they will be wearing nice loafers, just all black, able to wipe the leather off, and sterilize those loafers in full. Also, the great thing about loafers is once they start to wear down or get a hole or a leak in them, you're able to visibly see that wear and tear. I prefer to offer my technicians split-free shoes. Hopefully, we can work with Shoes for Crews to get them all unisex loafers, so they're all being unison. Once they remove their blazer, they'll be in full scrub units. The blazers are not part of the hospital uniform, it's part of the outerwear, coming into work or leaving work, or if it's a situation where there's heat that goes out, they can have a jacket to wear if they're at a nurse station or just sitting at their desk. When they go visit patient rooms, they will not be wearing the blazer. The loafers are part of the uniform. They're welcome to get Dr. Scholl's or whatever makes the shoe more comfortable. I would love for all my technicians to wear split-free shoes just to minimize the fall risk. We'll talk about that later in the products and services, where we'll be offering split-free shoes for the elderly upon visitation. I am aware, and I do know, that they have socks with preparation on the bottom to help prevent the elderly from slipping. We want elderly to have actual slip-on shoes, not slip-in shoes, not a sock that can get wet, but an actual shoe that protects their foot to the fullest and provides maximum support when they're getting in and out of the tub, when they're getting up to go to the bathroom, back and forth. If they spill something, drop something, they may not notice they're the elderly. They're very delicate. Okay, so it would almost, if I could have it my way, be mandatory that all elderly patients wear split-free shoes while they're patients in my hospital. Hip falls, broken hips from falls. I've seen nurses, I've been in the hospital, I've seen nurses take very good care. They hold the patient, oh, please don't fall, take your time, just take it slow. They have to make so much initiative because the shoes that they're wearing, they can slip easily, and they can't keep their balance. If we have some slip-free shoes, that's a preventive effort. Hopefully we can work with Medicaid and Medicare and classify that as preventive care. Okay, because we're preventing that illness. If they fall and break their fist, you're talking about outstanding surgical costs. If you just wear a pair of $40 or $20 or discounted slip-free shoes, come on, which would you rather have? A broken hip surgery, healing time, injury, or some slip-free shoes? So my technicians will have the same protection. Next thing I'll do, they're welcome to carry a pen right here. I've chosen to carry the stylus, which I'll be using for the H.E.R verified software and DPU tracker tablet, stylus tip, pen for the notepad, also a backup pen. I've chosen the Mont Blanc here. It's a very reliable pen. You can drop it. It won't break. It still works good. It lasts a long time. It has plenty of ink refills. My company will offer Mont Blanc to high-performing technicians, so it'll be something that they can earn just as an incentive. One thing that I feel that my company will implement is the system of reward. We will definitely make sure that they're rewarded for all of their efforts. No person will go unnoticed. We can't give an award for every little thing, but we will have a board that acknowledges employees that aren't using their PTO for vacations and maybe using it to go volunteer at other hospitals or volunteer, such as Scottish Rite or St. Luke's. Patients that may be volunteering at the Children's Museum, volunteering at the Star of Hope, volunteering at the food bank on their PTO, on a Friday, on a Thursday. Just go put in some volunteer hours. I would just be so proud to hear that from my technicians. And I will definitely have a board that acknowledges that type of behavior. I have articles that go more in depth. One of the main reasons why I would like to honor and acknowledge my employees that use their PTO for volunteer hours is because I think it helps build compassion. I'll tell you a quick story here. The Star Hope, which I volunteered at the age of about 9 or 10 years old, I opened up a Christmas list that I was assigned to pick gifts for this family. I didn't know the family, just said boy, girl, and mother in the age group. So, as I looked at the list, I was thinking I was going to see Barbie dolls. I was thinking I was going to see computers or laptops or doll houses or things of that nature. Instead, it touched me. I saw comb. I saw brush. Things that I didn't look at as gifts. I was 9, I was 10. I didn't realize that a comb and a brush was a necessity. It could be a Christmas gift for someone. She just wants to maybe go find a job and needs a brush and comb to clean up her hair and have a good hygiene. She didn't even have a comb and a brush. Or maybe she did have a comb and a brush and it was old. It was raggedy, it was broken. It was super glued together. Who knows? She wanted a comb and brush from the Star of Hope. I believe that things are put in place to test people, but at the age of 9 or 10, I don't think it was some type of trick someone played on me or something. I think it was real. I truly believe that was an actual request. You may be listening and say, oh, they probably just had somebody write that, or, just because there's so many conspiracies and so many, lies and foolishness that goes on or whatever. I don't believe that was the case. I personally believe that this individual wanted that, and I was 9 and 10. It taught me compassion. It brought tears to my eyes. I've got a document that you're welcome to request that talks about how volunteer work influences and teaches compassion. There are a lot of people that do things for the money. There are a lot of people that do things just because they were trained to do it, or because their mother or father did it, or it was passed down to them, part of their lineage, or whatever the situation may be. But the opportunity to use the volunteer hours to work at, use your PTO for volunteer hours will help teach compassion for my technicians, and they will be acknowledged for it and earn points and be rewarded and things like that. They will also carry around business cards. So my corporation is also called Lex Enterprise Incorporated. The Healthcare Intelligence Agency is a derivative of Lex Enterprise Incorporated, which I started up in 2009, incorporated in 2011, and launched the Healthcare Intelligence Agency in 2011, 2012. So on the back here, there'll be an email address listed, and there'll also be a phone number for them to contact directly. And then it'll have the company's or the office's phone number, email address, the website, where they can also look at materials, product services, request information, get phone numbers if they need, access to links, all those types of things. The motto of Lex Enterprises is innovation, the catalyst for success. I'm not going to claim to be the person that thought of every single thing myself. I just see a problem, and I like to offer a solution. If I see a better way to do something, I like to present that. I learned a lot from my experience working at Memorial Hermann, working at Business Scribes at Hunt Regional, and at Textile Resources. For more in Herman, I worked at Sugarland, Katy, and also TMC, Texas Medical Center. So I worked at 5 hospitals, so I'm a quick learner. I learn very fast. Despite the time that I spent with those companies, I picked up on a lot of stuff, and I saw a lot of room for improvement, and that's why innovation is the catalyst for success is my motto, because I learned from those predecessors, and I learned how to do things better and bigger, faster, and I learned what we were lacking. And there's always room for improvement. If you think that you're done growing, there's no way. You grow every day. We grow every day as a person, and no one is perfect, you know. People blame and point the finger and say, well, they could have done this, or I could have thought of that. It's not about that with me. It's about a collaborative effort. It's about having respect for your predecessors and them having respect for your initiative to make things better so we can all grow together and have a safe nation and have a great and excellent top-tier healthcare intelligence agency, healthcare initiative, healthcare system, healthcare management program, whatever you want to call it, healthcare, the dynamic spectrum, the full ladder of healthcare, superb. That's our goal, okay? And we want to do our part. So we're going to do that through innovation. So they'll keep business cards on hand, and they can write any notes that they want for the patient. You know, they'll be able to take business cards from patients. We will have a business card file in the, I'll show you an example. We will have a business card file kept in the office from anybody that we do business with, partnership with. People are always looking to network. Patients, sometimes they may be in their sick. However, they could be the head honcho of a big corporation, or they could be a small startup company or a small business owner, or they could just be someone that needs some motivational support or some resources. I know that they do have case managers and agencies that help with those type of things, like CPS helps children and all those things. Well, we're just going to make sure we don't forget anybody. So if they give us a business card or contact information, we'll have a spiral for all of them, and then they'll have some of our business cards in there as well. So remember, on the business card, on the back will be the personal cell phone that the patient contacts the technician on, and an email address they can email them on as well, which will come to their phone. And this is not the exact phone that they will be using, by the way. This is an example. And on the front, we'll have the general information, okay, for Lex Enterprises. The back will be their healthcare intelligence agency information, okay, to clarify it that way. The next part, my technicians, all of them, the H.E.R verified technicians, will wear, I'll use my jacket now. They'll have them. Okay. That's why we're going to have places for them to place their jackets, because you don't want to just throw it on the table. My cell phone's in there. I would have dropped it. The great thing about the blazer, it has a lot of pockets. So you'll have your entrance into a room. All my technicians will definitely wear a solid red shirt underneath their uniform to correspond with the red and the American flag. Their Bluetooth in one ear. These are the LG Bluetooth headphones. I've chosen this pair of headphones until something better comes out. These are the most reliable right now. They will have a matching scrub top and bottom top. My scrub set is intentionally a little bit oversized for comfort, ease, in workflow. We will not be wearing tight scrubs. So I'm going to basically try my hardest to make a unisex looking uniform. The blazer will be unisex, the scrubs will be unisex, the shoes will be unisex. That way, no one has to worry about identifying with gender or anything of that nature. You know, if you want to have your own swag, as they call it, in 2014, today is August 14, 2014. That's a well-known colloquial term. or have your own personality, your own professionalism. You know, we're not going to discriminate. But when it comes to the uniform, everyone wants to be in unison. We're going to be in one, just like in the military. If you're one person, you're a unit. They all wear the same exact brown shirt, the same exact BDUs. So it'll be the same exact black with the American flag to represent the country that we are in, and what nation and they're coming from. Okay, so my signature will be based in the United States of America as of this current time, and the flag, U.S. flag, will be representative of their protection as a patient under the Constitution. Okay, so that's the whole point behind the flag. The flag is not meant to be overly patriotic. It's not meant to say that America and our healthcare system is better than anyone else's. That's not the case. The flag is to show that we respect and we're here and you're wearing this uniform and we're conducting ourselves based on the Constitution of the United States. And it's not going to be solely the corporate mission, the corporate values. You know, there's only so many values, there's only so many missions. The Constitution is the one thing that we all follow, the one thing that stays the same and is equal and that's given to everybody. We're all protected by the Constitution, especially the First Amendment, you know, freedom of speech and things like that. So, you know, when they see that flag, I want my technicians to feel proud about who they are and know that they're representing the Constitution and they're not going to discriminate against any other patients or any of the employees, and they're representing the foundation that was laid for this nation, which is equality for all, and healthcare for all. Just like they don't turn away patients, well, we're not going to treat them different. Okay? So, matching scrub socks with the American flag logo, the matching pants bottoms, it'll be loosely worn. Okay? Slippery shoes. Slippery shoes, to reiterate, socks will be worn. They can wear whatever color socks because they're not visible. The one unique thing that my technicians will have will be a watch, which is used to record incidentals. So it will have a video camera capable watch. If they witness something that is illegal, we're not going to walk around with cameras, and we're not going to take photos on our tablets, because then everybody would see it, because the tablet is community property. They will have their own special watch that is capable of videotaping things that are going on in the hospital, and it's set in place to protect them and to protect the patient. If there's a situation where a patient doesn't want, a family member doesn't want one of my technicians to enter the room, okay, they can immediately start videotaping the whole conversation, and in a court of law, when it's presented in court, was this said or was this said, the video will prove the truth. I feel like I can protect my patients that way. I mean, I can protect the patients, and I can protect the employees that way. Hospitals, they can't possibly surveil every single move that everybody makes, but my technicians will be able to, at the press of a button, record what they need to record with discretion and integrity, okay, if they have a situation. If they have a situation where someone's pulling out a gun, cussing, acting irate, acting out of control, they can immediately start their video footage, and if that's being used against them. In Texas, it's a one-party state. It's not illegal to record anybody, so that's why if you look at social media nowadays, there are videos of people doing all types of things. It's a one-party state. If you're on the videotape, your voice is on there, your face is on there, you're on there, and it's not planted somewhere, you are allowed to record. So they are protected by the Constitution. So they can record an event where something could be jeopardizing their job, so they can prove their case. And it'll help them to make sure they handle situations as professional as possible, because guess what, if they're recording them, they're on tape too. So they're going to definitely talk to the patient in a calm voice. They're definitely going to state their case. We'll definitely see who came running to help or who came running to be messy. It'll start weeding out the weak. they will be paid very well. Okay? The next thing that I would like to say is, when I say pay, that's a topic that you don't bring up on an interview. However, you're like, well, you want your technicians to be able to do all this wonderful stuff. How are you going to pay them? Well, in the restaurant industry, it's based on gratuity. They get paid like $2 an hour, $2.75, whatever. It's below minimum wage, but they work off tips, so they earn those tips, and I guess it balances out. So I used to be a waiter in restaurants. I know this is a fact. Okay. So I was paid $2.15 an hour, and I worked off tips. My technicians will be paid a base pay, which I will not disclose at this point in time. But on top of that, they will get 18% gratuity from the services they provide to the rooms. Okay? So the more friendly they are, not pushy, the more they educate the patients, the more they help and engage with the patients to make their stay more pleasant and help them to heal faster because their mood has improved and they're not falling and breaking hips. They'll get gratuity off the items that they sell and things like that. So that'll go towards their paycheck. They're going to have the meal card. My technician will be taken care in full. I'm telling you, this corporation is going to be something that people are going to be begging at the door. Okay? It's like walking into a pre-med conference. They're begging to get in med school. So this route, you don't have to necessarily go to med school. You will be trained. Just like a scribe is trained to work with a doctor, you will be trained in preventing healthcare-associated infections and providing hospitality in healthcare. Those are two basic things. The next thing I would like to say is that pretty much completes the uniform. Stylus and pins. Another thing that they can have in their back pocket is their cell phone. They probably won't be sitting down too much. We'll just try to make sure they don't sit on their phones. Well, Sarah hangs on the neck. That's the good thing about it. You never sit on it. But if they're in decontam, they can, they're standing up in PPE. They can put it in their back pocket. Just make sure they don't forget to take it out, or they can carry it right here. But we'll make sure they know they bend over. It can fall out and break. They'll have screen protectors, all those types of things. And they'll have their tablet, which will be at either base stations or kept with them on the cart. So I would love to incorporate base stations in the hospital where they go to the actual adopt iPad station and input their information and do all their sterilization and patient diagnosis, comparisons, and evaluations and hospital volume tracking, and just basically get all the information you need to succeed. Look at all the orders that the patients have their priority list, all electronically done at the base station. But then I think about the element of a line. So if someone's waiting at a POS, for example, you're in a restaurant, you're waiting to put in the order, you gotta wait to put in the order, you gotta wait to put in the order. Someone else is doing the order, they're taking a long time. Well, hey, if they all have their own tablets, that'd be great. So hopefully the tablet will be, maybe we can have a grip on it. So if they're pushing a cart, it can be like a double grip. So it'll grip, basically, it can have a grip where it holds the tablet. Then there could be a clamp that pushes it and grips onto the cart. So they can push the cart and hold the tablet at the same time. Make sure it doesn't drop. I'm going to patent that. So don't steal it. So that's the type of things that we're thinking. And like I said, innovation. I don't know if that exists yet, but if it doesn't, that's definitely an idea. Whoever makes it best is who wins. Samsung tablet versus the Apple iPad tablet. They go for tablets. Who had it first? I don't know. Does this count as me having that idea first? But there'll be a way for them to have that tablet with them at all times. But there could be a possible integration between a POS, a docking station, and with an embedded iPad that's irremovable, or whatever type of touchscreen mechanism that we can implement in the best and most cost-effective way for hospitals, and then also have a tablet too. tablets as the healthcare intelligence agency is concerned in the hospital. Okay? They do have EMRs. They carry those around. They dock them. The only problem is sometimes they don't get plugged up and they don't get charged. So you got someone on a shift who's working with a tablet that keeps running out of battery. And so we'll have portable chargers. We're gonna, it's gonna be great. Just trust me. Has a lot of growth. We're getting a lot of input. It's gonna be a collaborative effort. I can't wait to, get these ideas up and going and collaborate with some of the best and see if we can get these inventions going, get stuff manufactured, get software developed and put on the actual tablet with the bumper guards and just, screen protectors. And also, I definitely want to say, the tablet that they will be carrying, if it is indeed like that, it'll have a reflector on it already. So when you look in that actual phone and you're not the user, it reflects your reflection back. It looks like a mirror, okay? But if you look at it directly, as with like a computer screen protector, then you can see. But someone over your shoulder or on the side won't be able to see what's on that information, so that will be HIPAA protected too. So it'll be a screen reflector. Another thing that in the future, as the corporation grows and hopefully goes all around the world, all healthcare agencies and hospitals and healthcare facilities all around the world, we definitely plan on anticipating a printer, scanner, and